World Health Day.
In my head.
Hello everybody, welcome to In My Head. Two quick things. The first, I'm from the United States of America, so if you're from a different country or a different culture, the things that I say here, they may not apply the same for you. Number two, I am not a licensed professional. Tomorrow, Saturday, April 7th, 2018, is World Health Day. The theme this year is Health for All. Follow the action on social media using hashtag Health for All. The aim this year is to get universal health coverage worldwide by 2030. Universal in universal health coverage means health coverage for all, without discrimination and leaving nobody behind. Everybody has a right to benefit from the health services that they need without falling into poverty to use them. Universal health coverage does not mean free coverage for all possible health interventions regardless of cost, as no country could sustainably do this. Universal health coverage is not just about healthcare and financing the health services of a country. It encompasses all components of the health system, systems and healthcare providers that provide health services to people, health facilities and communication networks, health technologies, information systems, quality assurance mechanisms, and governance and legislation. To give you some insight into the state of worldwide health coverage today, here are some facts. At least half of the world's people is unable to currently obtain essential health services. Almost 100 million people are being pushed into extreme poverty, having to live on $1.90 a day, or less, because they have to pay for health services out of their own pocket. Over 800 million people, almost 12% of the world's population, spends at least 10% of their household budget on health expenses, for themselves, a sick child, or other family member. But this goal of getting worldwide universal health coverage by 2030 is not an impossible goal. In fact, a lot of improvements have already been made in different countries around the world. If you'd like to hear some stories, there are stories in the Toolkit, which I will link down below. You can read about how health coverage has improved in countries like Ethiopia, Ghana, the Islamic Republic of Iran, Mongolia, Sri Lanka, Tajikistan, and Timor-Leste. Governments have the biggest role to play in providing universal health coverage through policymaking, but citizens can also help by urging their governments to implement policies and engaging with their communities. More ideas on how you can help can be found in the Toolkit. Now, since my channel is a mental health channel, I wanted to give you some facts about the state of mental health coverage worldwide. Only 1% of the world's global workforce works in mental health. 45% of the world's population live in a country where there is less than one psychiatrist per 100,000 people. Per person, low and lower middle income countries spend $2 on mental health. High-income countries spend 50. In low and lower middle income countries, there are 5 mental health beds per 100,000 people. In higher income countries, there are 50 beds per 100,000 people. 0 low-income countries have a national suicide prevention strategy. 1/3 of high-income countries have a national suicide prevention strategy. Clearly, there is a lot of work that still needs to be done. If you want to engage people in World Health Day, I will link to resources down below. Don't forget to follow the World Health Organization and use hashtag Health for All on social media. Health is a human right. No one should have to choose between good health and other life necessities. If you'd like to learn about mental health, head over to youtube.com/RyanLiberty. Go hit subscribe. Thank you for joining me, everyone, here on In My Head. Happy World Health Day!